So what are the ophthalmic features in a patient with intermediate uveitis? We need to look for vitreous cells, like I just mentioned. You have to look at the blood vessels to look for sheathing. Sheathing means when there is some kind of inflammatory cuffing associated with vasculature. You have to look for the presence of snowballs and snowbanking, which I will be elaborating soon. You can also look for vitreous hemorrhage. Apart from this, you have to look for cystoid. These are the complications and these are the clinical features. So, complications can be cystoid macular edema or complicated cataract, secondary glaucoma, neovascularization, which can develop in the on the optic disc or in the surrounding retina, and a patient can also develop disc edema. So, this picture is just to show you the amount of activity and what we need to look for. So, this is exactly what I was mentioning in the previous slide about focusing the slit beam onto the vitreous. So, this is the cornea, anterior chamber, the lens, and you are focusing the slit beam onto the vitreous, and you can see very well that there are small aggregates of material which is the vitreous cell. And usually vitreous haze is seen as a, we have what you call a Tyndall effect for observation of vitreous haze. That is, there will be a slight milky hue. A presence of a milky hue usually indicates that there has been some kind of transudation of proteins. Then the next feature to observe for is the snowbank. So, these spectrum of signs, like I have mentioned, have to be there in patients with intermediate uveitis. So, the snowbank is glial tissue that is organized in the peripheral retina. And why do I say it is peripheral? Because usually if the focus of the central retina will show us the optic nerve head, and this blood vessel is ending. So, blood vessels usually end in the periphery, and hence you call it the peripheral retina, and what you see here is snowbanks. These are snowballs. Snowballs again are substances that are present suspended in the vitreous cavity, and these snowballs are again aggregates of giant cells and macrophages and inflammatory material which are floating around in the vitreous. And this, like I mentioned, is vitreous haze. So, this is vitreous cell and vitreous haze. So, based on the classification that I just mentioned, vitreous haze usually is graded based on the visualization of the background retina and the optic nerve head. So, in this picture you can hardly see the optic nerve head. So, it probably means grade 4 or 5, and these are the small snowball opacities that you are seeing suspended in the vitreous. And the last, this picture is about chorioretinal scarring. So, here is a patient who has had probably this kind of a picture with the snowbanking, which after some time has healed, and the presence of, there is no active lesion here. These are all the scars, and what you are seeing here, the blackish areas, is probably secondary to photocoagulation of the peripheral snowbank or cryotherapy, depending on when the patient was seen. So, UBM, the word UBM refers to ultrasound biomicroscopy, and it is very useful. This investigation is extremely useful in patients with intermediate uveitis to identify exudates and cyclitic membranes. Now, unlike other structures in the eye where we can visualize areas in the by naked eye examination, the ciliary body is present behind the iris and it is hidden by the anterior structures. So, the only way to visualize the ciliary body is using an ultrasound biomicroscopy. And as we know by now, ciliary body is the most important area that is affected in intermediate uveitis. So, we need to do a UBM to look specifically for exudates and cyclitic membranes. The sound frequency that we use is 50 megahertz. And what are we going to look for? Vitreous condensations or membranes. So, this is the area of the ciliary body, and you look for areas of vitreous condensations which show up as membranes in this area. Peripheral retina and pars plana can sometimes also extend to the plicata. So, it does not restrict itself only to this area. You can see inflammatory activity even in the periphery. There can be fluffy condensation of the vitreous, and there can also be vitreoretinal adhesions. Now, this point is very important because it can result in, when the patient has reached this stage, it usually means that the patient has gone in for complications which can result in retinal detachment.